I'm Keiki Aquaro. I'm the acting administrator for the Child and Adolescent Mental Health Division of the Hawaii State Department of Health. I know a lot of parents right now are facing re-entry and trying to make decisions about that. The Child and Adolescent Mental Health Division recommends that parents don't take their children with them the first time they revisit their properties. Our recommendation is for parents to go, and it'll limit the traumatic impact on kids if they don't go. But then when parents return from the visit, we really encourage them to talk to their kids, answer the questions that they have about the visit, and try to explain to them in age-appropriate ways what it was like. So some of the reasons that we don't recommend that kids go with their parents when they're revisiting their properties, aside from the environmental risks, is that it can really lessen the traumatic impact if they're not there in person. So one way for them to be included is for them to just talk to their parents after their parents revisit their property. They can come back and talk to their child about what they saw. A lot of parents have been asking how to talk to their kids after this disaster. And, you know, parents know their kids best. I think our recommendation is just to let your kids ask you questions and answer those questions honestly and answer them in age-appropriate ways. It's okay for your kids to see your emotion about the event, as long as they're not seeing a violent reaction or a reaction that would be overly scary to them. But in general, parents really want to communicate to their kids that they're here for them and that there's somebody that their kids can talk to if they need to. And sometimes kids will ask questions about seemingly unrelated events, and it's important to spend time talking to kids about that too. Anything that kids bring up that they're worried about, we're just encouraging parents to listen and to do everything they can to reassure their kids that they're safe now. I think a lot of kids experience trauma in different ways, and of course it depends on how old they are. Some universal things that you might see in your child is a change in their sleeping too much or not enough, change in their appetite. They might be more anxious. Younger kids might regress to more babyish behaviors, might be more clingy. And, you know, all of these reactions are to be expected after a trauma. It's really important to help kids feel safe again after the fires. And so reassurance is really key. That can come in the form of a lot of cuddling and physical contact, as well as just talking to your child and answering their questions honestly and in age-appropriate ways. You also want to be careful about how much media coverage they're exposed to. If they are going to be exposed to media coverage, we recommend that parents are there with their kids to answer any questions they may have about what they see. And then I would say it's also really important for kids to have as much of a daily routine as possible. Really helps their lives feel predictable again and can reestablish a sense of normalcy. Say anytime a parent thinks that is worried about their child, is worried about their reaction to the disaster, it's always okay to reach out for help and guidance with that. Some parents feel most comfortable talking to their PCP about the behaviors that they're seeing in their child that's worrisome. Parents can also, there are a lot of resources online. There's a website called helpyourkeiki.com where parents can go to get resources. Hawaii Cares is another site that can give parents some resources and tips about what to look for. If you want your child to see a behavioral health specialist, if you're in a hotel right now, many of the hotels have mental health professionals stationed in the lobby or in talk story tents, and that's a place to get help. You can also go to the Lahaina Comprehensive Clinic, which is by the Lahaina Civic Center, and behavioral health services are available there for folks of all ages. There's no eligibility criteria, and you can go there for help as well. This has been such a devastating time for everyone, and it's really important for people to remember that they're not alone, and that there's strength in community, and that it can help to talk about what you're going through.